Okay, so we are at the top of the hour +1. So I'm going to go ahead and get us started. Good evening and welcome to the Air Pollution Control District's Clearing the Air workshop. I'm Matt Mudd, the communications coordinator at the district. I'll be taking us through the workshop, and once it is time, passing it over to our guest speaker. I'll also be monitoring the chat during the workshop, so don't hesitate to send a message or a question as you think of them, but those questions will be answered during the Q&A portion following the presentations. A little bit first about our Clearing the Air workshop series. It was designed to offer the public a more accessible look at air quality subjects, a look at the work of Louisville's local air pollution control agency, and an opportunity to interact with the professionals tasked with protecting Louisville's air. Often, residents only interact with local government in formal settings that don't provide an opportunity for interaction or feedback. This is hopefully an opportunity to address that issue. We also like to use it as an opportunity to bring in other community experts to share their knowledge and offer that same space for interaction. After a brief presentation from APCD today, our guest presenter today will be Luz Huntington-Moskos, an associate professor and director of community engagement, the community engagement core for the Center of Integrative Environmental Health Sciences at the University of Louisville. Before we get to today's subject, a few quick webinar notes. Want to make sure that everyone knows tonight's workshop presentation is being recorded. So we are starting off with all of our attendees muted, but once the presentation is complete, we will stop recording and open the floor for questions and discussion. The workshop video and the presentation slides will be posted to our website in the coming days. Again, please send messages or questions to the chat as you think of them, but they'll be answered during the Q&A portion following the presentations. If you think of a question after you leave, please feel free to email it to us later at air@louisvilleky.gov. There are no such thing as silly questions here. This work can be complicated, and our best tool to clear the air, as it were, is hearing from you. Afterwards, please let us know if you have feedback on this workshop or ideas for future workshops. There will be a short survey available to you after the workshop, and we'd love to hear from you anytime at air@louisvilleky.gov. So, we're going to get into tonight's topic, air quality and your health, resources, and guidance. A quick look at the roadmap for the presentation. First, we'll go with an ambient outdoor air quality and health presentation from the APCD, then our guest presentation on indoor air quality research, and then a little bit about our ongoing work and discussion and Q&A opportunity. So first, to kind of frame our discussion and overview of outdoor air pollution and health, what contributes to poor air quality and where do those pollutants come from? So you have a graphic here that kind of shows the gamut. You have natural sources like wildfires, even trees, area sources, houses, gas stations, smaller sources that are stationary. You have mobile sources, anything from planes to trains to cars, diesel trucks, buses, any kind of gas-burning vehicle. And then you have stationary sources that includes industrial sources like factories, power plants, things like that. So really a variety of places, many of which you all are probably familiar with. So that we kind of have a basic information on the sources. Very broadly, we'll talk about some specific pollutants and categories of pollutants. So first, you have criteria pollutants, which are a group of 6 air pollutants. You'll see them listed there: ozone, particle pollution, carbon monoxide, nitrogen dioxide, sulfur dioxide, and lead. These were established as criteria pollutants through the Clean Air Act because they were considered common in the outdoor air, harmful to public health and the environment, and they come from numerous and diverse sources. A little bit more on this later. Because of these factors, the impacts from criteria pollutants are often felt more regionally, kind of on a broader level, more broadly than other pollutants. And health-based national ambient air quality standards are set for these pollutants for our area and for areas throughout the country. They are monitored for throughout the country at monitoring sites, and EPA is required to regularly review these standards and the science behind them to determine whether changes are warranted. You'll see at the top there that I bolded ozone and particle pollution. That's because those are the pollutants, the criteria pollutants of greatest note here in Louisville. And we will move on to kind of briefly show you a look at Louisville's current national ambient air quality standard status. Like I said, these are the standards set for those criteria pollutants. We'll dive a little bit deeper into our NAAQS status at our next workshop, which is called State of the Air, and that'll be hosted in early January. That'll be a look back at Louisville's air quality in 2023. Or if you have questions about this after this, we'd be happy to answer them. But briefly, as you can see, we are in attainment of all of the standards except for that for ozone. Actually, based on design values in 2021 and 2022, we met the ozone standard and currently have a request for redesignation submitted to EPA, but we have seen more elevated ozone this year due to hot, dry weather and wildfires, and that makes it a bit more complicated now. So we are waiting, and we are also awaiting new stricter fine particle pollution standards from EPA, and those are currently pending. So now a little bit more health and background information on those two pollutants of note. First, particle pollution. So this is a term that refers to a complex mixture of small particles and liquid droplets. In the ambient air, they can produce haze and low visibility. They're split into two categories. So that includes coarse particles, PM10, or fine particles, PM2.5, which are even smaller, 2.5 micrometers or smaller. Sources of particle pollution include coal-fired power plants, diesel engines, residential wood burning, and wildfires. If you remember last summer when we had those wildfire events from the Canadian wildfires and it impacted air quality here, fine particle pollution was actually the pollutant of concern when that happened. So that's a kind of a real life example of particle pollution impacts. You remember those were both visual and health impacts. Exposure symptoms to fine particle pollution include increased respiratory symptoms from asthma, COPD, etc., as well as heart symptoms like irregular heartbeat, strokes, cardiovascular disease, and heart attacks, and they can also present in an allergy-like form. And perhaps Louisville's most persistent air pollutant is ozone. So ozone is a clear gaseous pollutant formed through a chemical reaction in the air. That chemical reaction includes NOx, VOCs, two different types of pollutants, plus sunlight, and that creates ozone. Exposure symptoms to ozone are mostly respiratory. They include coughing, shortness of breath, and other respiratory issues. It can exacerbate asthma, COPD, and other pre-existing health issues. Because sunlight, heat are important factors in the formation of ozone in our air, ozone season in Louisville runs March through October. And on high ozone days, concentrations tend to be highest in the late afternoon and early evening as that ozone has had time to build up in the atmosphere throughout the day. Like I mentioned, ozone, unlike many other pollutants, is not emitted directly into the atmosphere from any source. It is formed secondarily due to a chemical reaction in the air. So a little bit more about NOx and VOCs, which are the precursor compounds that are part of the chemical reaction that produce ozone. NOx is a group of highly reactive gases, including NO2, which is a criteria pollutant in and of itself, that can irritate airways and cause respiratory issues. NOx primarily gets in the air from the burning of fuel, so it forms from emissions from cars, trucks, and buses, power plants, and other off-road equipment as well. And then you have volatile organic compounds. Volatile organic compounds, or VOCs, are compounds that can easily become vapors or gases and contribute to the formation of ground level ozone. This is not a criteria pollutant itself, but it can be an air toxic, which I'll talk about more later. These also often cause odors. So they come from a variety of indoor and outdoor sources, like gasoline engines, and when you're fueling, they escape. Those smells that you smell at fuel pumps or VOCs. It comes from chemical production, printing, solvents, paints, and consumer products. That can include hairspray, it could include nail polish, you name it, anything that produces that gaseous odor. So thankfully, when it comes to criteria pollutants, there is a tool available to kind of help people take action to protect their own health and plan around your exposure to these criteria pollutants it's called the Air Quality Index. So this is a scale created by EPA to communicate health impacts of air quality conditions in the outdoor air. This is for criteria pollutants. The AQI values it's a value scale that ranges from 1 to 500, and those 1 to 500 values are sorted into health-based categories that range from good to hazardous. So a value of 100 on the AQI scale generally aligns with those health-based national standards that we talked about earlier. So pollution is measured at sites throughout our city. The highest pollutant sets the AQI for an individual site, and the highest site in the city sets the city's AQI for the day. So we're kind of operating as though everyone is being exposed, or the highest exposure is the exposure that we're paying attention to when using the air quality index. So here is what it looks like. You have the color-coded scale, like I said, ranging from good, that basically says air quality is satisfactory and air pollution poses little to no risk, up to hazardous, health warning of emergency conditions, everyone is more likely to be affected. I'll go on to the next slide. That's the air quality index you can find on our website, and it's a great tool, especially for those looking to reduce their exposure. One way that we use the air quality index is to forecast it. So the Air Pollution Control District works with the Indiana Department of Environmental Management to use meteorological data and modeling to forecast for our two most notable criteria pollutants, ozone and fine particles. So these forecasts help residents plan to reduce exposure and their air pollution generating activities if it's necessary. So if the AQI is forecast to be unhealthy for sensitive groups or worse, I'll go back here to show you real quick, unhealthy for sensitive groups or down. So any of those categories worse than it, an air quality alert is issued. These air quality alerts include the pollutant and the AQI category that it's expected to be that day. It also includes the sensitive groups, which kind of vary based on the pollutant that we're forecasting. It also includes actions that can help reduce your own emissions and your own exposure. Second line. So when an air quality alert is issued, sorry, you're prompted to take action. First, most notably, it's to reduce your exposure. So and usually here in Louisville, an alert will be issued for, we'll often see, or a few times a year, see unhealthy for sensitive groups as the alert. Very seldom will we see unhealthy for all. Last year during those Canadian wildfire smoke events is actually the first time in quite some time that we did see those unhealthy for all alerts issued as forecasts. But the basic guidance is to limit and avoid heavy outdoor exertion, especially if you're in those sensitive groups, to take more breaks, do less intense activities while you're outside. Protective gear like an N95 mask works for some pollutants, like if it's a smoke event or a fine particle event, but it doesn't work for others, like ozone at least as well. The AQI for ozone tends to be highest in the late afternoon and early evening, like I mentioned earlier. And fine particle pollution AQI is more likely to vary throughout the day. So those types of considerations will be included in the alert when it's sent out. It can vary based on pollutant. It can vary based on the level of which the forecast is sent out, or the level on the AQI the air quality is expected to be. We also ask when we send out those alerts for folks to reduce their emissions. We have a program called our Air Quality Action Partners program that asks businesses not only to receive those alerts and send them out to all of their employees to keep them informed about air quality conditions, but to take actions to reduce their own emissions, whether this is through actions like using less gas or shutting off some processes that create pollution that day, and two, just regular emissions reductions actions that folks can take, like working from home instead of driving your car into work, reducing idling, reducing energy use, which is a big factor for pollution generation. We also, when we send out these alerts, because it's usually the day before when we forecast, ask folks the following day to follow the live air quality index monitoring that we have. So like, say, a forecast for the weather, forecasting has its limitations. So APCD and other agencies throughout the country operate air monitoring networks that provide live air quality index values. These are made available through websites like our Louisville Air Watch and EPA's Air Now. and they include the AQI category, and as you can see in that picture, some basic health guidance. Tools like EPA's EnviroFlash can also send you an automatic text when the AQI reaches a certain level, whether that's moderate for you, unhealthy for sensitive groups, unhealthy for all, just so you can, in addition to planning ahead when an alert is issued, have the guidance right on your phone that tells you right now is the time to not go outside, or it's morning and it's an ozone alert day, so we know that pollution's probably not as high yet. So these considerations with the live monitoring can help you be even more precise when planning your day and kind of understand what you're doing. So that's kind of our main health consideration and guidance for criteria air pollutants, those commonly occurring kind of widespread pollutants. Now we're going to talk a little bit about hazardous air pollutants, also known as air toxics or toxic air contaminants. So this is a group of other air pollutants that are not criteria air pollutants and are known to cause cancer and other serious health impacts. So kind of a way to frame it, there are 188 of these as compared to those 6 more common or more commonly widespread criteria pollutants. So as such, air toxics come from a variety of sources and have a wide range of health impacts and also a wide range of environmental impacts like odors. But as compared to that kind of broader regional impact that I talked about with criteria air pollutants, we kind of associate these impacts from air toxics and sources of air toxics tend to be more localized. Think of fence line communities, those right next to, say, a source of air toxics pollution, or right next to a large highway or something like that. That would be a source of these other air pollutants, as well as the criteria air pollutants that we talked about. So air toxics are regulated locally through APCD's STAR program. Emissions of air toxics are. This goes beyond federal law to limit emissions of air toxics. Air toxics are also monitored for in near real time at 2 APCD monitoring sites, one at our Cannons Lane monitoring site and one at our Algonquin Parkway monitoring site. Briefly about the STAR program. The STAR program sets what are called environmental acceptability limits based on health risk. So for example, for cancer risk, no individual air toxic in an individual process at a facility may cause a fence line cancer risk of over 1 in a million. Facility-wide, that number may be no greater than 7.5 in 1 million. At new and modified sources, that number is 3.8 in a million. For reference, EPA generally uses a lifetime cancer risk of 100 in a million as an upper boundary of acceptability. So when I talk about how our local regulations go beyond federal regulations, that is one example. And we are seeing progress on air toxics emissions. Since 2005, emissions of all air toxics called toxic air contaminants by STAR have decreased by 80%. Category 1 toxic air contaminants, those that are of greatest concern or were of greatest concern when STAR was passed, have decreased by about 96%. And I would be remiss to talk about health and outdoor air quality without at least discussing odors. I know that this is a common concern for residents. It's something we hear about often. Common sources in Louisville of odors include sewers, industrial sources like those in Rubbertown and the meat processing facility in Butchertown, as well as open burning. So many of the substances commonly emitted from these sources can cause a nuisance odor at far lower concentrations than it would take to cause an immediate health impact. So they're very annoying, but even at concentrations where they don't cause a health impact, which there are, that fact doesn't necessarily do justice to the impact on quality of life and health, mental and physical, that odors can have. And we know that these are a stressor for individuals, and it's something that we spend a lot of time working on. We will provide a slightly longer update on our odor work at our State of the Air workshop next month. But if you have any questions, feel free to ask them as well at the end of this workshop. We encourage you, if an odor is a nuisance, please report it to APCD. We have staff that investigate and work to address them. And if you feel an odor is affecting your immediate health and safety, please call 911. That is our guidance. Now, I've kind of covered some outdoor considerations, given you our overview. Think of your questions. I'm going to pass it along to Our guest presenter, Luz Huntington-Moskos, an associate professor and director of the Community Engagement Core for the Center for Integrative and Environmental Health Sciences at the University of Louisville. Today, she'll be covering some of her research regarding indoor air quality, and we're really looking forward to hearing more. So I will stop sharing and pass it on to you.
Okay, I'm happy to be here. Thanks for everybody taking some time out to discuss this. I think it's an important topic. We'll see if I can get my slides to share. Hopefully you're seeing them. I'm just trying to get them into presentation mode now. Let me know when you see them in full screen.
I'll let you know. If you want me to share, I can also do that. If it takes a minute. Oh, I see it now, so we're good.
Great. Okay, well, as mentioned, my name is Dr. Luz Huntington-Moskos. I'm at the University of Louisville School of Nursing, and I work with a great team of individuals across the country. So the work that you're about to see is a team of us from Louisville, from the University of Kansas, the University of Chicago, and the University of Illinois, Chicago. So we try to have this nice Midwest team effort to talk about indoor air quality and getting a real-time capture of the data. So what you're about to see is what we call a feasibility study. We wanted to see if we could really do this, if we could share air quality monitors with real people, see if we could survey them and if it was useful to them, if they liked the monitors, if they felt it was worth their time. So before we made any sort of bigger study, we had to make sure people felt this was helpful. So I'm going to take you through the process of our preliminary findings and let you know that we are hoping to expand this work and have larger numbers of people involved. So in 2020, when COVID hit us and we were all very much homebound, our research team members got together and thought, wow, we're all very interested in respiratory health. We work with people who have asthma. We're really curious about this change where people are staying homebound quite a bit. And so we wanted to see what was going on with people that have asthma and their home environments. So we sent out a survey called the Global COVID Asthma Survey, and we had people across the nation and even some international participants share with us some of their thoughts about their asthma symptoms. And through that, we had over 1,000 participants in this survey. We learned that people were using a lot of disinfectant products, and that use had really skyrocketed almost during that time. And that makes sense because we were having so much issue with learning about COVID and COVID transmission. So we learned that really people were using up to 5 times as much disinfectant use per week, and really big percentages. So you'll see this graph right here on the left of the screen. This is the number of people that were reporting using disinfectants more than 5 times a week, and showing you the green column is before COVID and the estimation in the red column is after COVID became a reality for us. So we as scientists were very concerned. There are a lot of volatile organic compounds found in personal care products and cleaning products. And so we wanted to make sure we were seeing how this might be impacting people's asthma at home. And it's important to remember that ordinarily people spend 70% of their time in their home environments. We spend a lot of time sleeping there, time on weekends, time in the evenings. So we really wanted to see how this was impacting. So our study aims was to see, is this possible? Can we use home monitoring and a home spirometer to, the spirometer looks like something you would use for your rescue inhaler, but it actually checks your lung function. So we had a home spirometer, an air quality monitor, and we used something called ecological momentary assessment, which is a fancy word for surveying people through a smartphone app. We were trying to catch what was really happening in people's homes. So we've had just a lovely discussion of what outdoor air quality that we all share together with Matt Mudd's discussion before this. And the reason we're interested in indoor air quality is because all our indoor environments are very unique to us. We all buy different personal care products, different cleaning products. We all have different insulation and ventilation and fan usage. So we really wanted to kind of see what is happening in people's home in real time through the surveying of an app. So what we did was we asked those same people that took the global COVID asthma study, would you be interested in participating in another study? And so we recruited from that group of 1,000 people plus, and we had this criteria that's on the right-hand side of your screen. Were they adults, current asthma diagnosis? We tested them with a short survey called the asthma control test, which if you have asthma, you might be familiar with it. It's about 5 short questions and it gives you a score. And the higher the score is, the more poorly controlled your asthma is. So if people had higher than a 19, 19, 20, 21, 22, and upwards, we wanted them as part of this study to see if these exposures were exacerbating their symptoms, making their symptoms worse. They also needed to have Wi-Fi and smartphone access, which is kind of tough because that may vary across populations. And ideally with research, everyone can be involved. So this smaller study helped us figure out, could we send out hotspots to people? Could we send out phones to people so that even if people didn't have access to these things because of economics, personal economics, that we could provide that to them so we could get as many people involved as possible. So we had, it was a fairly lengthy study with different components. So we had a baseline survey that they took. Then we sent out the home spirometer and the air quality monitor. We had a Zoom call or a phone call to set all of it up. Here, where would you like to put your home air quality monitor? Let me help you make sure you download the apps. Do you have any questions? And then once that orientation Zoom call was done, we had a 3-day period where we watched to see if everything was functioning properly. And then people had the monitors for 2 weeks, and we saw their data come in. We were connected through the Wi-Fi. We instructed them to use their home spirometer if there was any sort of survey or interesting data that triggered the surveys. And then we were able to do some follow-up interviews at the 7-day point and after at 14 days. And then when it was all wrapped up after the 17 days, we were able to take a screenshot of the data. It shows a nice wave pattern. I'll show it to you. And we were able to describe everybody's personal patterns and send it back to them in an unlisted YouTube video so they could kind of see their own data. So this is some of the apps I wanted to share with you. So we used an Omni Aware home monitor. So that's what you see on the left. The actual app for that is the middle screen with the yellow 69 there. The Aware has a Aware score that goes all the way up to 100, and it's green from 100 to about 80, and then about from 79 on it goes to yellow. So it kind of gives them a nice stoplight sort of signaling. And then this is another screen that shows up from our end where you can see the Aware score on the actual device. So this is what we would see. This is the pattern, the waveform. Excuse me. So this might be a particular person's wave pattern over, this just shows a day, but we were able to show 2 weeks of data and how it increased and decreased. And this was for VOCs, volatile organic compounds. We wanted the level to stay below 333 parts per billion. So you'll see the measuring line on the left-hand side. It goes 200, 400, 600. So we definitely wanted it to stay below 400. And the bottom horizontal line is the time of day, and often the date is shown there. So one interesting story I can give you is that I had some young people using these over 4th of July weekend over the summer. And I could see real big surges in particulate matter during the 4th of July weekend. And you might imagine it's because of the exchange of indoor and outdoor air and people with fireworks and different sort of festivities happening that might have changed the indoor and outdoor air. There is often, whether we like it or not, some exchange with indoor and outdoor air that can impact your indoor air situation. So methods, again, it's fancy. It's called EMA, Ecological Momentary Assessment. But what it really is an app that just sends you a survey to your phone. And this is kind of what it looked like with the banners and the different surveys that you would have. So the top left is just the banner that would come across the smartphone. And then it would show you what survey you needed. So a check-in would be like an early morning survey. You would answer like 5 questions. And then if something triggered, because we had the air monitor connected to our EMA platform. So if you were burning toast or something, let's say your air monitor is in the kitchen and you burned your toast, and it would show that there would be elevated particulates because of the burnt toast. And then it'll send a survey immediately to your phone and say, we were just received a trigger survey. Your particulates are elevated. What are you doing right now? Are you in your home? Do you have asthma symptoms? Please use your spirometer right now. So it kind of helps communicate in real time and capture what's happening in your home, in theory. And then this is what the spirometer data looks like. So at the top right of your screen is the actual handheld spirometer. It fits in your hand. And then this shows the actual graph shows the actual lung function that you're seeing throughout the day when they're signaled to use the spirometer. And then these are some samples of some of the questions that we asked. So, did you use hand sanitizer? Did you use infectant wipes? Were you using bleach or water to clean? Because we wanted to kind of think of what sort of personal cleaning practices, personal care products that might be used that might be impacting your indoor air quality. So this is a kind of graph or schematic. I think sometimes visuals are really helpful to understand how things were connected. So number 1 is meant to show you the home environment. Is someone cooking or cleaning or using any sort of air products or printing or burning candles, any of these things that might impact indoor air, and it would signal the air monitor to have elevated levels. And then that would send a signal through your Wi-Fi. And then that would trigger your survey. If something's going on in your home, we see that through your air monitor. Please fill out this survey. So you get a ding or a little banner on your phone that says it's time to do a trigger survey. You would hit that, fill out the 5 questions, and then it would say, please use your spirometer now. And then you'd be asked to use your spirometer, and hopefully it's handy, and you would use it to see what your lung function is at that moment in time. So we have these cutoff points, like I said, 333 parts per billion for VOCs, and we wanted to keep it below 15 micrograms per cubic meter for particulate matter, which is what we were talking about earlier with Matt Mudd and the wildfires. Particulate matter was a concern for all of us at that time. So we were looking to keep that below 15 micrograms per cubic meter. So those were the magic numbers. So we had 60 people participate in this, and about 40 went all the way through from beginning to end, completed the whole 17 days and got their data back. So it is a lengthy process, and that's why we did this smaller study first, to see if people would be engaged and interested and if they could devote the time to it. We all live really busy lives, and so before we have a really big study, we need to make sure that people feel this is worth their time. So this was the makeup of the people, the 60 people that were involved. And it's very typical of research. Research automatically attracts mostly women, mostly individuals who identify as white, and mostly people who are college educated. They readily, unfortunately, are the people that, fortunately or unfortunately, always have ready access and are interested and trusting of the research process. For lots of different reasons, it's sometimes hard to get others involved, and our goal is to make sure we all have access to this. Because I think it can be valuable information to everyone, but the research institutions and research in the past hasn't always done things right. So we have to make sure we try to do better and welcome everyone as much as we can. So this is the baseline data. This shows the average amount of time people spent at home, and this is on weekends and weekdays and weekends, which was very interesting to us. If you have an air monitor in your house, does it get good data because you spend a lot of time at home? Is it representative of the air that you will be exposed to? So that was very interesting to us to see how people were involved. And then on the side, you'll see the asthma triggers inside. So were people actually home when the asthma trigger surveys were sent out. And so you find by and large that did work. The survey triggered surveys were happening when people were actually in their homes, so it was very relevant. Also, here we wanted to see, would people complete these surveys? Again, we were all really busy. Was it a nuisance to get those surveys on the phone, or was it helpful and something that people would actually do? So we were actually really pleased to find out that people were completing these at greater than 50%. So the early morning ones were the least completed, but mornings are tough. So it might have been difficult for people to kind of catch that early morning survey. And then they were very interested in the triggered surveys. So if something happened during the day and the survey came to them as a triggered survey, we had nearly 80% of those completed, which we thought was a very positive sign. And then to the right, you'll see this asthma symptoms reported. So only about a little less than 10% of the asthma symptoms was what we were able to capture with our participants. It just shows you how hard it is to kind of capture the trigger and the asthma symptom together. But this still is a lot of data to kind of give us some insight. It would have been lovely if, every trigger survey caught some evidence of asthma symptoms, but life is much more complicated than that. So we felt pretty lucky that we were able to capture almost 10% of asthma symptoms to see how these things are linked. And then here, another thing that's very interesting, we tried to ask people what they thought was actually triggering their asthma. And they were able to give some educated guesses. I was painting my nails right when that went off, so it must have been the nail polish. Or like I said, I burnt my toast and then the alarm went off and I got a trigger survey. So sometimes people can make connections because it's very obvious to us. But other times you just don't know. And I'm not really sure why it went off. So you'll see that 53% of people were like, I don't have a clue what's going on. I'm not really sure. And a lot of times it's because our indoor air environment is complex, right? It's a mix of lots of different things. And sometimes we're also not always aware of what's happening. We don't always connect the dots. I myself, all of us on the research team made sure we had one of these monitors to try it ourselves because we didn't want to do anything that we thought was a waste of time. So I have an aware monitor in my house as well. And I've actually put it in my daughter's room, who is, at the time when I put it in there, she was 16. And so we really got to know, when she's putting perfume on before she heads off to high school, the monitor would go off. And she really got used to the idea of what is actually impacting my air. That was really exciting for us to see that even someone as young as 16 can really kind of make that connection when they see the monitor in, in sight in their rooms. So conclusions. What did we learn? We do feel that we got some really nice responses. We did what's called acceptability surveys at the end, where we asked people, was this acceptable to you? Do you think it was easy to use, usability? Did you feel that it was worthwhile to get this information? Did you like the report back with the video? Was it informative to you? So for the most part, the 40 people that finished from beginning to the very, very end had some really positive responses, that they felt that it really added to their understanding of their asthma and their indoor air quality. So it was enough positive response that we are really trying to scale up this to make it a much bigger study. So we finished with 60 people enrolled, 40 all the way to the end, and we're hoping to have a much bigger study that might be closer to 200 participants. And we have grant applications that have been submitted this past fall to see if we can get the funding to do that. So you may be hearing more from us to see if you might be interested in having an air quality monitor and a spirometer sent to your home and work with us as a team. But we found that this is possible, that people found it worthwhile, that we can make those connections for people and have that communication, that we can do it in an ethical way that keeps people's information locked down and secure to make sure, because, a lot of these devices, they have GPS, they use Wi-Fi. You have to be really careful as a researcher that you're keeping people's information confidential, and you're being a very good steward of that information. So we really try to get good procedures down so that if and when we are able to expand this research, that we're doing it in an ethical way that keeps our participants safe and good partners with us. We did find that VOCs and particulate matter were very common exposures at home, that more than 90% of our participants had some sort of volatile organic compound triggered and particulates in the home, which makes sense to us. And then as elevated asthma symptoms were reported in conjunction with these elevations and triggered surveys. We're digging into that research a little bit more, and we're going to learn more with time because we just wrapped that up this year. But we do find that there is a positive correlation. So very promising results we'd like to build on. But first and foremost, we're really happy with the data that this is actually something that people might be interested in, that it might add to their quality of life and their understanding of their asthma. So I just want to acknowledge our team from multiple different universities, kind of keeping Kansas and Chicago and Louisville connected to do this work and work with those communities. And this has been an NIH, National Institute of Environmental Health Sciences funded work. And that's all I have for you today.
Excellent. Well, thank you so much for your contribution. I'm sure I have a question or two that I'm excited to ask after we get through the rest of the presentation.
Excellent.
But just thank you so much for sharing that really interesting research, and I'm sure that if you have another call for participants in a more expanded study, that we'd be happy to kind of help share that information too. So
Wonderful. I'll be on standby when we're ready for questions.
okay, excellent. So back to the kind of roadmap for the rest of the presentation. We're just going to do a quick little walk through some things, some resources that might be of interest, or some ongoing work and links that might be of interest to you all on the subject of air quality and health, and then we'll move into time for discussion and Q&A. So a couple of things, one in particular that is of interest and kind of fits right into the frame of health and air quality. The Air Pollution Control District actually just received a $1 million grant to do a new air monitoring and health action project in West Louisville with a focus on the areas surrounding the Rubbertown corridor, along with partners on the project that include the West Jefferson County Community Task Force, the Louisville Metro Department of Health, the Park Duval Community Health Centers, and the U of L Enviro Institute. So this is something we're very excited about. During this 3-year project, the partners will complete an air pollution monitoring study at various locations in West Louisville, and results of this study will be used to develop and support policy recommendations for air pollution and land use to reduce air pollution exposure. And the data will be used, this is a particularly exciting thing, to help medical practitioners improve early detection and treatment options for those who have been exposed. So we'll be sharing more information as that project gets underway, and we're receiving a lot of support in getting the word out and getting the community involved, especially from our partners at the West Jefferson County Community Task Force. Other projects, we also know that we will be receiving funding for an air sensor lending library. We will acquire a kind of, as it says, a library of air sensors. And those will be available for community groups, schools, other people to apply to use for their own air monitoring studies, to kind of look at air pollution at the neighborhood level in their own neighborhoods. So we're excited about that, the opportunity for public involvement that that'll bring, and the opportunity for people to learn a little bit more about their own localized, like I said, neighborhood air quality. We also have been doing research projects with EPA. So some of those are around air sensors, new air sensor monitoring technology that can be used by residents, as well as updated monitoring studies, like one in West Louisville at our Algonquin Parkway monitoring site, where we had a project where canisters were set out that were opened at the triggered by odor reports, so we could collect samples and learn more about what might be collecting odors. So that's a very interesting research project that will help us learn a bit more about local air quality. We also have our CARE program and its Idle Free initiative. That's mostly based around steps that individuals can take to reduce their own emissions and take to help their own reduce their own exposure to air quality. Their Idle Free program concentrates on unnecessary idling of vehicles and reducing car emissions through when you're parked and just sitting there, or using drive-throughs or things like that. So uh, those hotspots of cars and vehicles, whether it's a highway or a parking lot or a school car rider line, can be triggers for folks when it comes to air quality issues. We've also included in here links to some updates on our sewer odor work. Like I said, we'll be touching on that more at next month's Clearing the Air workshop on the state of the air. We have more information about our STAR program linked, which I discussed earlier, a link to our Air Quality Action Partners program, and because it is not just APCD that will be doing work to look at air pollution, I've included a link to the Land Development Code reform process, which kind of takes a look at land use and in a variety of ways. But our input is included in the currently ongoing Land Development Code reform process, and so I put that link in there for you all to look at further. But that is all I have on the presentation for now. And as we switch gears to discussion and question and answer, a couple more items to note. First, we will share this presentation slides and a recording on our website. This is both an opportunity for people to come and talk to us and a resource. So there's also a ton more information on our website, from partner programs and community resources to additional air quality information. So we hope that this and those can be a resource for you to explore further. We also want to make sure that you keep up with us where you can. You probably do in some way because you're here, but we're on social media like Facebook or X and Twitter at LouAPCD. And we have an email list which has news about workshops like these, APCD public notices, and more. So now I will stop sharing and we will end our presentation recording.